Let's talk about how to release a perineal tear, scar, or an episiotomy scar. So often we will have scarring and tearing around this area. So this is the vaginal entrance, the anal entrance, and then we've got the perineal body in the middle. Maybe I'll get another image as well. So around through here. Often scarring is down through this area. If you've had an episiotomy, it's often off to the side. And if you've had a perineal tear, it's anywhere through this area. Some people have labia or tears up towards the clitoris. So anywhere that you're having that pain and discomfort, this is where we want to focus the massage. For argument's sake and for ease of demonstration, we're going to be focusing on this part of the pelvic floor because that's the most common, which is the posterior fourchette or the base of the vestibule. So often what I tell people to do is either use their fingers, or if it's a little bit tricky and some people don't like touching the area, get yourself a pelvic floor wand or a set of dilators. Now, whether you choose a wand or a dilator is kind of up to the person and maybe dependent on the symptoms that you're having. So if you're having a lot of pain with intercourse, if you're struggling to achieve penetration, if it feels really tight and uncomfortable, dilators are probably better. If you can achieve penetration, but maybe there's an area that feels particularly stingy or particularly tight, a wand is going to help with more direct treatment. I'm going to show you both. So if you're using a wand for episiotomy or for perineal scar tissue massage, we're going to first of all put intimate gel on the wand up to the neck, lots of it, and you might also want to put some on the entrance of the vagina. We're going to insert the wand into the vagina, only about 3 or 4 centimeters because we're normally focusing quite externally or quite superficially. And what you're going to do is first of all just find where some tension or tightness is and hold the pressure down through that area. You might take a deep breath in and exhale. Let it go. You might hold it there for 2 rounds of breathing, 3 rounds of breathing, depending on how you feel. And then you might turn the wand to the other side and do the same thing. Deep breath in and exhale. Come back to the middle. You might put some pressure down through that area. Deep breath in, deep breath out. And again, moving through different areas, finding areas of discomfort, holding there, taking some deep breaths. That might be where you start. You then might progress to sweeping. So you might come towards 9 o'clock and sweep down towards 6 o'clock, come towards 3 o'clock without any pressure, and then a little bit of pressure down as you move towards 6 o'clock. And you might just be doing sweeps from side to side, gently at first and gradually getting firmer and firmer with your pressure as you come down through that base of the vagina and that posterior fourchette tissue. You're basically working to tolerance. So we don't want to go over a 3 out of 10. We want it to be kind of uncomfortable, but not necessarily painful, because over time, as that scar gets more malleable and it gets less sensitive, you'll naturally be able to put more pressure through it. So don't want to push through that pain at the start. Your body's pretty smart and it's trying to tell you things. So you're sweeping from side to side. The next progression then might be to contract and relax the pelvic floor. So I'll demonstrate this on my hand. How's it going to be best? Like this. So you pop the wand in again, you pull down a little bit on the tissue, and then we might squeeze pelvic floor on and relax. Squeeze pelvic floor on and relax. As you squeeze on, you hold the same pressure, and then as you relax, you pull the wand further down. So squeeze on, same pressure, relax, pull it down. So you're basically exaggerating the stretch on that tissue as you relax the pelvic floor. It's already lengthening, and then we're helping guide it even further by using the wand. So contract, keep it still, relax, pull down. Contract, keep it still, relax, pull down. You can then do that same sweeping technique with the contract, relax. So you hold the pressure, contract, as you relax, sweep. Contract, as you relax, sweep. Contract, as you relax, sweep. And it's a similar concept to what we use in other areas of the body. If somebody's trying to get more length, say out of their leg, if I push down into my hand, I can then normally take my leg further, because it's a principle essentially of activating a muscle, which then contracts it, and then we can get more length through the muscle. Not to be confused with strengthening and really squeezing on and tightening and tightening and tightening. We're doing the tighten so that we can get that relaxation. So if you're somebody who can't contract their pelvic floor well, if you can't tell the difference between being contracted and being relaxed, that's maybe not the best one for you. But if you're confident you know what on feels like, and you can also let pelvic floor go, that can be a really good one. Getting individual advice on these things is of course always beneficial. So that's how you would do it with a wand. If we were doing it with dilators, You would choose a dilator that's appropriate for you. So if you're currently having some discomfort with just a single finger going in, if you can't achieve penetration with your current partner, you would want to go probably a small set or a medium set. A small set starts the size of my pinky, and a medium set would start a little bit bigger than my index finger at a size 3. This is a size 2. So most people are probably starting somewhere between a 2 or a 3. And initially what you would do is pop the dilator again with lots of intimate gel on at the entrance of the vagina, take a couple of deep breaths, try and relax the body, and very gradually you would just insert the dilator into the vaginal canal until it's all the way in. If you can't get it all the way in the first go, that's also totally fine. Again, we're trying to abide by that 3 out of 10 pain levels and always listening to your body. Initially for someone, if they're having a lot of restriction through the pelvic floor and a lot of tightness, and that can often happen if somebody's had, say, a traumatic birth, or maybe they've had instruments or things didn't quite go to plan, the body often can have a pain and fear response after that. And so your pelvic floor might actually be really quite tight. So you really need to go slowly when you're doing these things and always listen to your body. But if you can get the dilator all the way in, you might leave it in for 2 to 3 minutes initially, take some deep belly breaths, focus on relaxing the jaw, the belly, the bum. And then you might take it a little bit out and just do some circles left and right. And if that feels okay, then you might pull it out, put it back in. So we're just trying to create some friction through that scar tissue and through the vagina. And then if that feels okay, you might then sweep it from side to side the same way that we did with our wand. So I'm just moving it up and down, up and down. And you can see that that dilator is kind of bending. So it's not as firm as the wand, which is really unbendable. And that is why I said at the start, if you've got specific areas of tightness, the wand is better because you can really pull and maneuver that tissue. The dilators are going to work better for overall sensitivity and tightness and for creating friction through an area. So you're not going to get that same pull on the scar, which is not what we want if we're using dilators. So just moving it from side to side, creating some discomfort, but no pain from side to side. Once that feels fine, and you've done a session with no pain and you've done another session with no pain, then you would move up to the next size until eventually you're getting to our bigger sizes to be whatever the size of your partner is. So if your partner's, say, a size 6, you would be aiming for a size 7 or a size 8 so that you're always going one size bigger than what your ultimate goal is, so that your brain knows that penetration is safe with the size that we've done in a safe, controlled environment. You would then just progress through the same things that I just did. So slowly insert, taking deep breaths, leaving it in there, maybe doing some circles, some in and out, some side to side, until there's no pain, no discomfort left. If you then have maybe one area of tightness, that's when people might then finish with the wand to then work through that specific area of tightness. So all of that's focused quite externally, or assuming that a lot of the discomfort and restriction is at the entrance, which it often is. But we know that anytime there's kind of a trauma to an area, often it's not just localized to that area. And this is where a wand is really beneficial because the pelvic floor deeper to that often holds some tightness, and that can give people deeper pain with penetration, or it can also give them hip pain and lower back pain. So you can then use the wand to release this deeper layer of the pelvic floor as well. And so you would go into the entrance, down towards your bum, and then essentially find a tender point on your muscle until that kind of subsides, and then you would move it again. And this is really just trial and error of moving the wand really slowly in the vaginal canal until you find a sore spot, holding some pressure there, taking some deep breaths, and then letting go. If you want any more information, or if you have any other questions, you want specific videos about anything in particular, let me know. Otherwise, you can find more information, more videos, more resources, and all of our products at bn.com.au. All right, hope this was helpful.